Hello, my name is Sarah Painter, and I'm a second-year Communication Sciences and Disorders major here at Bowling Green State University. My project, an assessment of communication between speech-language pathologists and intervention specialists in schools, was a survey study focused on collaborative efforts between professionals. My primary faculty advisor was Dr. Colleen Fitzgerald, and my secondary faculty advisor was Professor Brittany Joseph. I began my research with the intention of learning how speech-language pathologists and intervention specialists work together. I was surprised to find that there was little literature pertaining to these two groups of professionals whose caseloads oftentimes overlap. There was sufficient research pertaining to speech-language pathologists and general education teachers, as well as larger teams of professionals, but little to no research on that of speech-language pathologists and intervention specialists. This initial realization is what prompted me to study speech-language pathologists and intervention specialists collaboration more specifically. Since some terms will appear multiple times throughout the slide, I have noted some abbreviations that may come up here. Speech-language pathologists may be referred to as SLPs, intervention specialists may be referred to as ISs, and general education teachers may be referred to as GETs. Articles on collaboration primarily focus on speech-language pathologists and general education teams, teachers, or other teams of professionals. In assessing the literature around the subject, there was discussion on the idea of therapy shifting to take place within the classroom. In the past, speech and language therapy have primarily taken place outside of the classroom by removing the student from the room and taking them to an alternate location for the therapy session. However, in recent decades, there has been more of a push towards in-classroom therapy. This shift creates a greater need for professionals to collaborate since they will be working together more often. One reason for this shift is due to the need of students to be able to communicate in daily life and various social settings. When therapy takes place within the classroom, there's more awareness of how these settings function and how to apply therapy practices to real-life scenarios. There were also findings that professionals tend to collaborate more in urban school districts than rural school districts. Limitations to collaboration occur as a result of the large caseloads of speech-language pathologists and educators alike. The roles of professionals may overlap, but to fully meet the needs of students and cover the full range of student needs, professionals may need to work together to clarify what their roles will be in the process of treating the child. As I developed my project, two key research questions became evident to me. First, what is the focus, modality, and frequency of collaboration between speech-language pathologists and intervention specialists? Second, what are the benefits and barriers to collaboration between speech-language pathologists and intervention specialists? The focus of collaboration was assessed by looking at what topics are addressed during the collaborative process and what collaborative strategies are utilized. The modality of collaboration was assessed by looking at what types of therapy are utilized and how collaboration occurs, whether that be designated meeting times, talking in passing, or via email. Finally, the frequency of collaboration was assessed by asking how often these professionals had meetings, talked in passing, or emailed. Benefits and barriers were assessed through open-ended questions about participants' views. These questions guided me in the development of my survey and interview questions, and also in the interpretation of the results that came in. These questions were important to me in the development of my research because they allowed me to holistically assess the collaborative efforts of these professionals. After completing my literature review, I began with the survey portion of my study to gather data on this topic, which will later be followed by a smaller scale interview portion of the study. Participants were currently practicing school-based speech-language pathologists and intervention specialists. These surveys were sent out via Bowling Green State University faculty to former students, as well as other contacts were provided via word of mouth or provided to the researchers. Thus, the exact number of individuals who received the survey is unknown. However, there were 37 speech-language pathologist participants and 15 speech intervention specialist participants. Surveys were a safer choice to use because they could be shared via web link, since many in-person events were not able to happen due to the COVID-19 pandemic. My reasoning for choosing survey research was primarily to get a large pool of participants. I wanted to be able to have sufficient data to work with that represented the overall views of both professionals. It was also important to me that these surveys had a quick response time to allow for a simplified process for both the participants and quick results as the researcher. Closed-ended questions were primarily used throughout the survey to provide clear-cut responses. There were only 4 open-ended questions to ensure I was getting results that could be easily interpreted and utilized. However, while the survey would give me beneficial data that would be easy to interpret, I was worried that it wouldn't give me a depth of answers or that some participants would feel it didn't accurately reflect their views. Therefore, I provided an option for 4 open-ended questions as well, where individuals could collaborate more on the benefits, barriers, and primary information covered by collaboration. Before distributing my surveys, I developed my anticipated outcomes or hypotheses based on what I knew about the collaborative efforts of speech-language pathologists and general education teachers. I predicted that the focus of collaboration would be on curricular requirements and therapy needs rather than sharing differing expertise. I also hypothesized that the frequency of collaboration would be limited due to time constraints and workload size, but would take place more often between speech-language pathologists and general education teachers. Finally, I predicted that the mode of collaboration would come in the form of unplanned collaborative efforts, leaning more towards email and talking in passing than designated meeting times. I thought benefits of collaboration would include sharing resources and goals, as well as the ability to learn from other professionals. I thought the barriers to collaboration would include time constraints, often as a result of workload size and limited planning time, and a lack of knowledge of the other professionals' job roles and how to utilize the services they offer. When looking at the focus of collaboration, 53% of speech-language pathologists helped intervention specialists develop curricula to meet student needs. Roughly 45% of intervention specialists helped speech-language pathologists develop therapy to meet classroom needs. Both professionals also agreed that speech-language pathologists were primarily able to help with social skills, vocabulary, and speech, which includes both articulation, the forming of speech sounds, and phonology, which looks at the patterns within speech sounds. Therefore, while there is a divide on whether or not collaboration occurs, there is consistency in what the focus of the role of collaboration is. When looking at the modality of collaboration between professionals, speech-language pathologists primarily indicated using pull-out methods of therapy in which they remove students from the classroom, and intervention specialists indicated that speech-language pathologists were not incorporated within their classrooms. While speech-language pathologists may not be incorporated in the classroom directly during the school day, they may give intervention specialists information such as binders of materials or pamphlets on how to incorporate therapy strategies into the classroom routine. Both groups shared that speech-language pathologists do share how to incorporate these therapy methods into the classroom, indicating that there is sharing of information to provide for crossover methods between therapy and classroom. When assessing the frequency of collaboration between intervention specialists and speech-language pathologists indicated that pre-planned meetings happened either weekly, 1 to 2 days per month, or quarterly. However, intervention specialists primarily reported these meetings as occurring only quarterly, which indicates that they primarily meet when assessing the students' individualized education plans. Other results on the frequency of collaboration found that speech-language pathologists noted informal communication decreased after the COVID-19 pandemic, while intervention specialists saw no change. And while speech-language pathologists did indicate emailing daily, no intervention specialists did report emailing daily. Both speech-language pathologists and intervention specialists were asked to report on the benefits of collaboration through open-ended questions. Speech-language pathologists primarily reported creating more consistency for students, an increased ability to meet goals, learning about the students from the intervention specialists, who are often able to spend more time with them, and being able to utilize different ideas to treat the child. When students have consistency of goals, both in therapy as well as the classroom, they are more likely to reach these goals because they are more clearly defined and enforced by multiple professionals. Since intervention specialists oftentimes spend more time with the students, they may pick up on things that the speech language pathologist isn't getting from the limited time they have with the student in therapy, which allows the team to better treat the whole child if they are collaborating on what the child needs. Intervention specialists found benefits to collaboration include working on student needs as a team, utilizing different ideas, and having the speech language pathologist look at students from a different perspective. As mentioned earlier, working on student needs together creates a more defined and better implemented goals. Speech language pathologists may also see different aspects of the child through the therapy process and can share these ideas with the intervention specialist to allow for the child to be treated more holistically. Speech language pathologists and intervention specialists were also asked to report on barriers that hinder collaboration. Speech language pathologists indicated that there was not enough time for collaboration. Both professionals had tight schedules with limited overlap that made it difficult to find times that worked for both. Intervention specialists did not always buy in or want to help speech language pathologists with their therapy process, and often both parties had large caseload sizes, thus making it difficult to meet the needs of students. One speech language pathologist reported the need to focus on more severe students because it was too difficult to collaborate on all students on the caseload's needs. Intervention specialists primarily reported not having enough time for collaboration not being able to be purposeful planning time, and different schedules that didn't overlap to create opportunities for collaboration. My first research question inquired about the focus, modality, and frequency of communication between intervention specialists and speech language pathologists. I anticipated the focus of collaboration would be on curricular requirements and therapy needs, rather than sharing differing expertise. However, I found that both groups indicated that the focus of collaboration was on sharing differing expertise and meeting student needs. For the modality of collaboration, I anticipated that collaboration would most likely be unplanned, but both groups indicated that the most frequent form of collaboration was informal discussion, indicating that my hypothesis was supported. Finally, I anticipated that collaboration for speech language pathologists and intervention specialists would occur more often with one another than with general education teachers. Speech language pathologists' answers supported this, but intervention specialists were more likely to collaborate with general education teachers than with their speech language pathologists. My second research question addressed the benefits and barriers to collaboration. I anticipated that benefits to collaboration would include sharing resources, goals, and learning from other professionals. Based on the responses that were received, these themes seem to be supported. Intervention specialists tended to view benefits to collaboration as being able to assess and work on student needs together, while speech language pathologists tended to view benefits as allowing for more consistency in student needs, addressing academic needs in therapy, and therapy needs in the classroom, and overall being able to better meet student needs. The predicted barriers to collaboration were time constraints and a lack of knowledge of what the other professional does to utilize them as a resource. Intervention specialists primarily discussed finding time to be the largest barrier to collaboration. While speech language pathologists also echoed this, they seemed to additionally struggle with getting the support of the intervention specialists and having them buy into the therapy process, both in and out of the classroom. The limitations to this study lend themselves to the ability to develop future directions to further elaborate on the themes within this study. There were three primary limitations to this study. First, the sample was primarily Ohio-based. While there were individuals from 5 states, the majority of participants were from Ohio, indicating that these results may not be able to be generalized to all professionals within the nation. The 37 speech language pathologists and 15 intervention specialists who completed the surveys may not accurately depict the feelings of the wider populations of these groups of professionals. The COVID-19 pandemic may have also skewed results, as individuals may have changed some of their practices as a result of the pandemic. Finally, the study may not have fully represented the feelings of all participants. While multiple choice questions were offered, individuals may have felt as though none of the answers fully fit how they felt about a given topic, but felt that they had to choose an answer anyway to try to provide the most information they could. In the fall of 2021, I will conduct follow-up interviews to allow individuals to elaborate on themes from the study and share deeper insights into topics they may feel were not accurately portrayed in the survey portion of the study. Another possible future direction is to conduct a similar study with a larger sample size and more diversity of participants to get a better depiction of whether or not the results are still supported. Thank you so much for taking the time to listen to my presentation today. And if you have any additional questions, please feel free to reach out to me at spainte@bgsu.edu.